Good morning and welcome to another installation of our Coffee with the County. Today I'm with Sarah Pratt, who is our Director of Health and Human Services. Good morning, Sarah.
Good morning, Mark.
How are you today?
I'm good. How about you?
Things are good. Things are going really good. Just a little bit about Director of Health and Human Services, Sarah. Let's start with you. How long have you been here with the county and where did you come from?
Sure. So I started with Aiken County it'll be 2 years in December. So I'm fairly new to the community still. I actually worked in Morrison County for about 17 years, starting out in child protection services, doing some intake, doing adult mental health and waiver. And in the last 5 years, I was a supervisor for public health and adult social services. So I've been in the county system for a very long time. This position came up in Aiken County, and I was like, let's try it.
Let's do it.
Let's do it. So here I am.
I know where everyone's excited to have you here, and it's been a great transition from a person that I think retired after many, many years, and you came in and have set the ball rolling forward still, and that's great to hear and great to see, and we do welcome you here and
thank you
into our county. And
it's been fun, and there's great people here and over in Health and Human Services, and so it's been a fun 2 years, I'll say that.
Yeah, interesting times. Huh?
Mm-hmm.
So what does Health and Human Services Director do? What do you, it feels like you're in charge of many, many different departments and many things, but maybe you could give our listeners a little recap of what is Health and Human Services?
It's quite a loaded question. I was thinking about what does a director do, and I think that changes by every day. And so I think, I have very competent professional supervisors that run the different program areas that we can talk about in a minute. And so I feel that my role is to keep the ship moving, if that makes sense. And so always looking out for the big picture. What does the future look like? Making sure that we're going to move forward in a positive, fiscally responsible direction, as well as making sure that everything's currently running smoothly and efficiently, making sure that my supervisors have what they need to lead responsibly and in a way that they feel motivated, as well as keeping staff motivated, energized to do the really hard work that Health and Human Services does. So
it is difficult work, taxing work.
Yes.
And you've got to have a special mindset, I think, to be able to do that. You got to be a special person to be able to work in some of those environments, which we have some really great people. You mentioned department heads or supervisors. Are there a number of different department heads and supervisors at HHS?
Yeah, so there's many different departments in Health and Human Services that have a supervisor attached to them, and then staff underneath them that help run these programs. And so we have accounting, which really just maintains the budget for Health and Human Services. I said really just maintains. That's a massive undertaking in itself. So if Carly's listening, she's like, what did she just say? And they also process payments and do our collections and all of that. So a very important department. I couldn't do my job without Carly, I can tell you that much. Behavioral health unit is ran by Rebecca Person, and it's adult mental health and substance use disorder and adult protective services. We have our home and community-based services that Kim Larson is the supervisor of, and that's our mid-choices assessments and our disability and elderly waivers, which is really services to keep people safe in their homes and keep them in their communities. So that's a very big program area. I should have said Carly's last name in accounting is Carly Goebel. Sorry, Carly. Children's Services is supervised by Jesse Schultz, and that is child protection, child welfare, truancy, children's mental health, child care, adult and child foster care licensing. Then we have public health, who is ran by Erin Mells, and that is our WIC, our health education, our immunizations, our disease prevention and control, child and teen checkups, suicide prevention, emergency preparedness. I can't give you all the programs all these people do, but just giving you an overview. Financial services supervised by Jesse Goebel, and that's our cash assistance, child care assistance, food assistance, and our healthcare programs. And then child support supervised by Julie Lewis, and that is, working with parents to get kids the financial support that they need. So that is all the different areas that intersect. Carly Goebel, who does accounting, also supervises our office support team. That is our front desk. They are the first people see when they come in the front doors, and that place would not run without those three women. So
it is amazing if you're not familiar, like most of us are not familiar with all of the things that HHS or Health and Human Services departments do. It's an amazing amount of work that gets done to take care of the community and take care of all of our citizens that are out there that are in need. Some of the supervisors you mentioned, I would love to welcome in and do specific conversations with them on some of the details of their programs in the future, if that's a possibility. I think that very important that we continue to let our listeners and our citizens, residents know what it is that we have for you and how can we support you and that type of thing.
Yeah, I think they'd be very open to it. I think, the supervisors and I and Health and Human Services staff, we really just try to abide by the vision, mission, and values of Aiken County. So nice. Making sure that, we're people focused, we're professional, we collaborate, we're innovative, we're fiscally responsible. I mean, we really take all of those things to heart to make sure that we're providing quality customer service while paying attention to the resources in our community. So these supervisors are amazing women. The staff are the hardest working staff you'll ever see. So I'd love for you to meet with some of them.
Yeah, absolutely. Yeah. That'd be great.
Yeah.
Appreciate that. We'll hopefully get them in and we'll do some great conversations for our listeners. Any kind of spotlights or anything you want to talk about? I'm asking you a lot of questions. You have anything you want to tell the listeners?
I think Health and Human Services, since I have started, we've, had the luxury of having Dr. Bill Brandell, as a county-wide initiative. And I think he's really helped me as a new director in Health and Human Services in working on our morale and our workplace culture. And so we've developed these 4 teams that are really employee-led, and it's just been fantastic. They're working on things to help with retention, satisfaction, and job performance. And so the Health and Human Services staff, they're running with it. They're excited about it. It's just been really fun to see. So I think that's exciting. It's a somewhat of a 2-year initiative, and we developed our own strategic plan in Health and Human Services. Aiken County has their strategic plan, but then what is Health and Human Services about? Where are we going? Where do we see ourselves in 2, 3, 4, 5 years? And so just really trying to keep all of that at the forefront and make sure that we are recruiting talented people, we're competitive, and people are happy with where they're working and what they're doing, and so that's really what that initiative is all about.
Yeah, that's awesome. Those are a couple of spots that you mentioned, one previously and one just now, of how our departments kind of interconnect, right? With staffing and with trying to build workforce. And I know turnover has been an issue in not only the county area, HHS, in many departments here, but also out in our community. Staffing and keeping good workforce going has been difficult. And childcare is an economic development issue. And if we don't have enough childcare at home, the childcare providers, then the people are going to stay home, and when they stay home, they're not working, and it's just a vicious cycle that we work together on. So
yeah, and we're seeing workforce shortage just affecting us in Health and Human Services because the people that provide the community-based services or are staffing our foster homes, or that's a shortage there, and so that means extra work for Health and Human Services to ensure our people are safe and staying in their communities. And with that, we actually developed or are working on developing 2 new foster care settings. One is for youth. It's a 1 to 2 bed setting, and one is for adults. And really, typically foster homes are about 4 beds, so 4 people. These are more 1 to 2 bed settings to help our people that have more high behaviors and need extra supervision. And so what that does is keep people here in their homes, out of the hospitals, out of residential treatments. And so we can give them the staffing and the supervision and the services that they need right here in their hometown. So that's super exciting that that's coming. And we have a couple providers picked, and we're working on developing those settings. So
yeah, that's awesome. You guys got a lot of programs that are proactive and developing to help our community, which is so awesome. If I was a listener, and where would I go literally to find the information? Are you located here in the government center, or where is the building that you're located in?
Yeah, Health and Human Services is its own separate building next to the Sheriff's Department. And so we're not in the government center. We are an older building that we are in much need of a remodel, which is being discussed as well, and currently being talked about and worked on whether or not that is going to come to the forefront is unclear at this time, but something that definitely is needed in our community. But yes, they can come to Health and Human Services. We have intake workers and front desk staff that will help direct them. We have our own page on the county website where they can find resources and departments and phone numbers and emails of things that they need. So I would suggest they either check out the website or they give us a call, and we will direct them to the right people.
Awesome. Anything else that you want to cover that you want the listeners to know about at this point?
I don't think so. I think I covered it all. I just think it's important that people understand the work that we do and how much we strive to keep our community safe and healthy, and really that's our job. And a lot of the staff that come into this work do it because they love it, and because it's just always been a passion for them. So sometimes it's hard to not burn people out because of the emotional toll that this job takes. So it takes the right person to do this work, and so I just want the community to know that's really in our forefront is keeping people healthy and happy and in their communities. So
yeah, the employee well-being is important, as well as more important, the community out there is what is most important. It's amazing. The staff is a special staff. You mentioned you need special people for that, and I think you have it. You should be, everyone in HHS should be commended for the work that they do. As you're out and in our community as listeners, get to know what HHS does, and more importantly, what it can do to help support you in our community. If you are in need of anything and have any questions, Sarah has let you know where to reach out. Call the office there, go on the website, figure any of that out, and we'll look forward to having some of your supervisors come in and talk specifics throughout, and be a great advantage for us to do this with Coffee with the County.
Yeah, and it's important to know that Health and Human Services collaborates with a lot of different departments here in the county, with different community partners, and we work with the schools, we work with probation, we work with so many different, we work with Aiken County Care, so many different partners that we work with to help us do this work. So I want to make it known that, it's not us by ourselves. We count on all of these community partners and the other departments in the county to help us do this good work too. So
yeah, that's awesome. A lot of different organizations or companies or things like that reaching out to give a hand up, and that's awesome to do that. Sarah, I thank you for coming in. I know you've got a busy day. I know that you've got, with everything that you just explained, there's a lot to do on an everyday basis, but thank you, Sarah, for coming in, and we appreciate having you here.
Thank you.
Absolutely. You're listening to Coffee with the County.